The University of Cape Town has released a report on the impact of COVID-19 on children. Although children have mostly been spared from severe infection, preoccupation with adult COVID care and preventing transmission of the virus has meant that children's needs were largely overlooked. And according to the UCT's report, children will likely carry the cost of the COVID-19 pandemic for years to come. Let's take this discussion further then. We're joined via Zoom by Laurie Lake, who is the Communications and Education Specialist at the University of Cape Town's Children Institute. A very good afternoon to you, Laurie. Thank you so very much for joining us here on SABC News.
It's a pleasure to be here.
Laurie, you say that in the report that, with children have been considered to be at lower risk of contracting the virus, which has really been sort of widely known in the country. But it's obvious that, the effects of COVID have had a tremendous impact on children, whether it's, due to the fact that schools are closing one minute, opening the next minute, or bigger issues like losing loved ones. Let's talk to the impacts of COVID-19 on our children.
So if we look at data from the Western Cape province, of the 284,000 cases of COVID that took place between March 2020 and March 2021, 12,000 of those were children. And 1,500 children were admitted to hospital and 59 children died. And that, the number of cases equates to 4% of the total caseload in the province. And on the face of it, that seems very small. And as a result, both globally and here in South Africa, we have tended to focus on COVID as primarily an adult disease. And as a result, resources have been diverted from pediatric units to adult COVID care within hospitals. And we've also seen a significant disruption of routine healthcare services for children. So if we were looking at data from the Western Cape, there was a 23% decrease in primary healthcare visits by children under 5 between 2019 and 2020.
Yeah. And
that has had a really serious impact on children's testing and treatment for HIV, TB, and malnutrition, all of which carry long-term costs in terms of the health of individual children, and also long-term costs in terms of the health system. So the briefs are essentially calling for a much stronger child-centered response to COVID-19 care, greater focus on keeping routine health services up and running, so that children aren't carrying the costs. And we know those costs are not limited to the health system. They are also shaped in very powerful ways by the impact of lockdown on the economy, rising unemployment, rising food prices, so that by April 2021, we were looking at 1 in 7 households where children went hungry. And we know it's not just about children being hungry. We know that what happens when households are scaling back on food expenditure is that they choose to focus in on starches, and children lose the dietary diversity they need to thrive and to stay healthy.
Yeah.
So these impacts on nutrition are impacting on children's health, making them more vulnerable to other forms of disease because it impacts on their immune systems. It also impacts on their cognitive or brain development, and that will have impacts on learning and on their economic productivity moving forward. So what we're seeing here as in terms of the immediate shocks and impacts on children will have a ripple effect potentially for generations to come. So we really do need to be shifting focus, to be putting children at the center of our thinking and our strategies moving forward.
All right. Laurie, I'm sorry, I'm going to have to pause for a minute. We've got our own breaking news coming through at the moment here on SABC News. We'll certainly come through to speak to you and carry on this very important conversation. Please do stay on the line for us there.